Now we will discuss the cardiac afterload. Okay, cardiac afterload. What is the cardiac afterload? Okay, it means that load. There is a load. Okay, and afterload mean what is the afterload? Okay, so this is your heart, this is your atria, and this is your ventricle, and from the ventricle blood move out. Okay, so what will happen? The blood move out, but it is against the pressure, and this pressure, that how much pressure and how much energy is need to move the blood against this is called afterload. Okay, so we'll explain what is the afterload. Ventricular wall stress during systole or ejection. Okay, when the ventricular wall stress during systole and ejection is called afterload. Okay, by law of Laplace, you can see that the wall stress is equal to the pressure multiplied by resistance divided by 2 multiplied by wall of thickness. This is the law of Laplace. But for simplicity, you can write it wall stress is directly proportional to pressure. If the pressure is increases, wall stress is increases. After load is increased, just like this. Okay. Now this is the aortic pressure. Aortic pressure is normally like this. Okay, and this is the ventricular pressure. So ventricle at diastole, the ventricular pressure is so much low, but systole the pressure is isometrically so much high, become a high to overcome the aortic pressure. If, for example, if you want, if you, this is your heart. Okay, your safe heart, your lovely heart. Okay, and here is the blood present, here is the blood present, and here is the aorta have also blood present, but here is the pressure is so much high, 3x. Okay, and here pressure is just like 1. Okay, if you want to move this blood into this area, what you need to increase the pressure. If you increase like this, no. If you increase like this, no, because now pressure is same. You increase like this, so much increase. So now all the blood move to from the all not, but all some of the blood move to this area, to the aorta. So this is called, this is simple mechanism. Okay, if you increase the, now here the pressure is increased from the aortic pressure, the blood move to the aorta. Okay, just like this. Now cardiac afterload is the resistance of the ventricle. Actually ventricle resist. For example, now this is the pressure. Okay, and ventricle contract so much strong to this resistance to flow the blood into this area. Okay, now actually this cardiac afterload is affected by systemic vascular resistance first of thing, another is the aortic pressure, and another is the wall disease. These three things are their systemic vascular resistance, aortic pressure, and the wall disease. Okay, so first of all, aortic pressure, when the aortic pressure is increases, the afterload is also increases. This is simple mechanism. Now if the systemic vascular resistance, for example, your system, your body have artery, veins, etc. What I am trying, sorry for that. Your body have artery, vein, etc. All things in present in your body. Okay, so if the, in the vein are the vessels. Okay, if the resistance is high, yeah, for example, this is your vessel. If they constricted, the resistance become high, but if they dilated, the resistance is less to the blood, and less pressure and less work is needed. Okay, so systemic vascular resistance is actually vasodilating factor and vasoconstricting effect. In vasodilating factor, for example, if ANP is released, it relax the smooth muscle, and the systemic vascular resistance decrease, and afterload is also decrease, so less pressure is needed here. Okay, and ANP function, you have to remember the ANP function. ANP is, when ANP is released, it dilate the renal arteriole, and GFR is increased, more water is lost, and the blood pressure become normal. So you have to remember the, what, when the ANP is released, when blood move to the atria, when more blood move to the atria and ventricle, it sends and release the ANP and BNP. Okay, now wall disease, for example, there are many wall disease. One is the aortic stenosis. If the blood, for example, this is your sweetheart. Okay, and from this area the blood move to the aorta, if this area is stenotic, if this wall is narrow and so much narrow, so more pressure is need to remove the blood, to move the blood. So that is called aortic stenosis. So more pressure is needed, more stress and more afterload. Now another is the mitral regurgitation. Mitral regurgitation is actually mitral wall is actually moved back. Okay, the stress is decreased, after load is decreased. How? For example, this is your sweetheart. During contraction, the aortic wall open but the mitral wall closes. But if the mitral wall can't close completely, so some of blood move through this area and some of blood move through this area. So it becomes so easy if you for example, a dog is moving behind you. Okay, and there are two way to you. Two, if there is one way, you have to move on that way, that is so much strong. If you have two way, you can move on both of them, because there are many parts. If there are many parts to you, you have relaxed, your stress become decrease, your afterload is become decrease. Just like this, if the moving path or the path is become increased, their stress is increased. Okay, and the afterload is decreased, their stress is decreased and afterload is also decreased. Okay, simple is that, everything is so simple. Now, so we have explained is, we will explain cardiac contractility in the next video. Thanks for watching.